A new study is suggesting the rate of high blood pressure disorders during pregnancy has gone up over the past decade in Canada. The research found rates of hypertension and preeclampsia increased by 40% between 2012 and 2021. The study's lead author says high blood pressure is dangerous for both the mother and fetus, but can be identified with regular monitoring and prevented with low-dose aspirin. The findings were published today in the Canadian Medical Association Journal. Joining me now to discuss is Dr. Catherine Varner, emergency physician and the deputy editor for the Canadian Medical Association Journal. Doctor, good morning. Glad you could be with us.
Thanks so much for having me, Marcia.
Can we begin with the why? Why are we seeing high blood pressure disorders go up in the last 10 years in pregnancy?
Well, we're seeing people come into their reproductive lives with more comorbidities or medical problems than they did in the previous generation. So not just high blood pressure, but things like diabetes, living with obesity, and other medical problems that people are coming into their reproductive lives with, which was not as prevalent in a generation before.
What are the consequences of high blood pressure, both for mom and baby?
So high blood pressure in pregnancy it can be quite dangerous, particularly if a person develops preeclampsia. And we know that people that have either chronic hypertension or gestational hypertension are at higher risk of preeclampsia, which is a condition that occurs later in pregnancy or in the postpartum period that can cause life-threatening seizures.
And so in the article, and we mentioned it in the intro as well, women can monitor their own high blood pressure, but then what? When do they go to the doctor and say, this looks out of the norm?
So I think what was really interesting about this study was that the authors showed that we saw higher rates of hypertension and pregnancy-related hypertensive disorders, but the risks of these hypertensive disorders were attenuated, meaning not as severe because of the scheduled access to care that pregnant people receive in pregnancy, particularly as they near delivery. But what we worry about in the emergency department, what we see is that access to care drops off steeply in the immediate postpartum period after delivery and when people are sent home, but yet that risk continues. And so in the first 1 to 2 weeks postpartum, it's important for people with hypertensive disorders of pregnancy or chronic hypertension to monitor their pregnancy, which they often do at home. But they often don't know what to do once they identify that their blood pressure is rising in those first couple of weeks postpartum.
So do we need to look at perhaps a new way of viewing healthcare following childbirth, that obstetrical care needs to continue even after the baby's born, doctor? So
there's certainly been studies out of the United States that have suggested that. And in fact, the American College of Obstetricians, particularly for patients with high-risk pregnancy, recommend early postpartum visits in that first 2 weeks postpartum. And there are programs here in Canada that are starting to create models of team-based care that include obstetrical specialists as well as midwives that are seeing patients in the very early postpartum period. And if they are identifying complications like hypertension, connecting with that specialist care provider to ensure that they have the care that they need in an urgent fashion, as opposed to waiting for that traditional 6-week postpartum visit.
Doctor, thanks so much. Dr. Catherine Varner is an emergency physician and the deputy editor for the Canadian Medical Association Journal.